Today's story is tragic, but essential. In the UK, a young infant has died of whooping cough, also known as pertussis, after their mother did not receive the recommended vaccination during pregnancy. This marks the first such death in 2025, highlighting a broader issue: sharply declining vaccine uptake across the country. According to The Guardian, this infant's death occurred between March and June and is the first from whooping cough this year. The mother had not been vaccinated, and the death coincides with the lowest levels of childhood and maternal vaccination in 15 years. Sky News adds vital numbers. Between 2013 and mid-2025, 33 babies have died from whooping cough in the UK, and in 27 of those cases, the mother had not been vaccinated during pregnancy. Understanding pertussis: it's a highly contagious respiratory infection. For newborns, who can't begin their own vaccinations until around 8 weeks old, it can be deadly. That's why maternal vaccination, ideally between 20 and 32 weeks of pregnancy, is essential. It passes protective antibodies to the baby before birth. Tragically, vaccine uptake among pregnant women has crashed, from a high of 76% in 2016 down to 59% in 2023, improving slightly to 73% in 2024. But still far below where it should be. At the same time, only 81.4% of 5-year-olds received their 4-in-1 preschool booster last year, another historic low. Almost 1 in 5 children starting primary school this year are not fully protected against diseases like whooping cough, polio, tetanus, and diphtheria. This means entire communities are less safe, and infants, too young to be vaccinated, face heightened risk. Dr. Gayatri Amirthalingam, Deputy Director at UKHSA, urges pregnant women to get vaccinated between 20 and 32 weeks, the critical window during which immunity is passed to babies. She emphasizes, vaccination is the best defense against whooping cough. Declining vaccination rates are fueling the return of preventable illnesses. Measles, once declared eliminated in the UK, surged with 11,000 confirmed cases last year. The consequences go beyond statistics. They are preventable tragedies unfolding due to gaps in protection. The fall in vaccination rates is linked to several factors: misinformation spread during the COVID-19 pandemic, underfunded public health services, appointment access barriers, and hesitancy in certain communities. Authorities are responding. From 2026, the NHS will introduce a combined MMRV vaccine, adding chickenpox to the measles, mumps, and rubella jab for babies aged 12 to 18 months. Meanwhile, healthcare providers are ramping up education and access to maternal vaccines. Thank you for listening to this urgent public health update. If this story moved you, please like, share, and subscribe, because awareness and action can save lives. And if you're pregnant or know someone who is, please talk to a nurse, midwife, or GP about getting vaccinated between 20 and 32 weeks. It's the best protection for your baby when they need it most.